A resurgent Ebola quickly spreading in the Democratic Republic of Congo and beyond. What's undermining the response? Some answers right after this break. Welcome back. You're watching World Insight. I'm Tian Wei. The World Health Organization has declared Ebola outbreak an emergency of global concern. The Democratic Republic of Congo is trying to contain viral infections that have already killed more than 1,700 people. The DRC health minister resigned on Monday in protest of the DRC president's announcement last week that he would take control of the response to the Ebola. Before we get down to a discussion, let's take a look at this.
Ebola is back. Ebola is a rare and deadly disease in people and non-human primates. Its main symptoms are fever, diarrhea, and unexplained hemorrhage. The second largest outbreak was in August in the Democratic Republic of the Congo, infecting 2,500 people. Two-thirds of them died. About 12 new cases are being reported every day. Last week, the World Health Organization declared the outbreak a global health emergency. Despite raising the threat level, Johnny Kangasong, the director of the African Centers for Disease Control and Prevention, remains optimistic.
The current disease outbreak in Democratic Republic of Congo is the second largest Ebola outbreak in the history of Ebola. Interestingly, about 700 confirmed cases have been cured. So this is very good news. So it means Ebola is not a death sentence, that we still have chances of surviving.
The disease is spreading very fast. Neighboring countries are closing their borders. This is worrying DRC citizens.
Countries bordering the DRC should not close their borders to DRC citizens, because if they do so, it will have a very negative impact on our economy.
Many of our people survive on trading with neighboring countries. If those countries close their borders, it will be a disaster.
According to the World Health Organization, a new vaccine has been used for containment. It is 97% effective, and more than 161,000 people have been given it. But everybody is not vaccinated, only those who come into direct contact with an Ebola patient and people who come into contact with them. The response to the latest outbreak has been complicated by sporadic attacks on health workers and conspiracy theories about the current vaccine.
So what's undermining the efforts to contain Ebola this time around? Let's loop in our panelists. In Nairobi, we have invited Peterson Wachira, who is the team leader and spokesperson of the Ebola Warriors Kenya. In Washington, D.C., Eric Ding, an epidemiologist and certainly health economist from the Harvard School of Public Health. In our Beijing studio, we have Shi Yi of the Institute of Microbiology of the Chinese Academy of Sciences. Gentlemen, welcome to our program. I want to go to you first, Mr. Wachira, about your experiences. You were among the 155 health workers from Kenya who left for Sierra Leone and Liberia in 2014 as part of a 6-month African Union mission to fight the Ebola outbreak over there. So why are we having a second largest outbreak this time? Haven't we learned the lessons from your perspective?
Okay, thank you, and thank you for having me. I think for DRC Congo, this is not the first outbreak that we are having. And in fact, one of the type of Ebola that we are having right now that is causing the outbreak, the place where it was found for the very first time is still in Congo, and that is why it's called Zaire Ebola virus. The reason, you're asking the reason as to why we are having a second outbreak, even having been able to manage the first one. And if you look at DRC Congo, the health systems are not up to where we expect them to be. And so when you do not have very good health systems, And that means that even the health workers themselves sometimes are getting infected. Like now we have 140 of them who have actually already been infected, and most have succumbed to the same. Then it becomes a problem.
But Mr. Vatira, when you were serving as part of the team to cure and prevent the outbreak of Ebola last time, 2014, what were some of the biggest issues as a health worker you have to pay attention to? What do you think could be the advice you can extend to your colleagues right now trying to fight the second largest outbreak ever in history?
When it comes to managing Ebola, there are a set of approaches that you must be able to take for you to be able to manage the outbreak. And unfortunately for Ebola is that most of the time there is a lot of stigma, and there are some customs and traditions that are attached to it, and some of the customs actually aid in the same transmission. Like when we were there, the reason as to why we were able to manage the outbreak is first of all because there was a strong political will from the government. The governance was very stable, and from there then you are able to go down to the citizens, especially in the affected regions, and you're able, using the communication strategies, to be able to do health education, so that you can be able to educate them first to identify that this is not a matter of customs or something that is beyond our understanding, like witchcraft, as we have seen in Congo. To understand that this is a condition, and that for them to be able to manage them, there will be need for them to be able to put some of their customs and traditions on hold.
All right.
So that we can be able to manage. Of course, the other aspects.
Go ahead.
Hello?
If you want to say other aspects. We understand there are traditions, but besides that?
Yeah, so the other aspect, of course, is that you must be able to have a very strong case management, where you are able to manage those who already are having infected with Ebola. Then you must have another aspect of where you have to address the episurveillance and contact tracing, so that you can be able to get everybody who has come into contact, and you're able to monitor them over the next 21 days.
Well, I guess that is probably the rule for all kinds of transmittable diseases you have just mentioned. It's a laundry list of must-do things. But for now, I want to thank you, Mr. Peterson Vatira. And I understand, Mr. Vatira, you have to go for now for your mission. Thank you so much for joining us. And now let's talk to other guests. Dr. Ding, thank you so much for waiting. Well, I'm talking to your African colleagues now. The vaccine is already there. Is the vaccine going to play a big role this time in preventing and treatment of the second largest outbreak? Briefly.
Thank you for having me here. The first Merck vaccine right now, there is a very limited quantity. There's only 250,000 doses, and it requires a very extensive sub-zero cold chain. And right now, they don't have enough for everyone. And for vaccine to work, it needs to be available for everyone. Right now, they're only using it for ring vaccination of infected people's friends, relatives, as well as aid workers. But this is not, even though the vaccine is 97% effective, you need a vaccination program for everyone. And for that, we need the other vaccine. There's the Johnson & Johnson experimental vaccine that requires 2 doses, 8 weeks apart. And those, they have 1.5 million doses ready to test, and that one they want to give to everyone over the age of 1 year old. But that one is still experimental, but there are series, there's the Merck vaccine and the Johnson & Johnson experimental vaccine that is ready to go, but it needs to be given to everyone, not just the ring vaccine around the people who are infected.
Well, now is it possible, Mr. Shi, sitting here with me, Professor Shi, is it possible that every one of them will receive a vaccine? It sounds very much too much of a luxury at this moment, isn't it?
Luxury?
the vaccines, because Dr. Ding was talking about everybody could have a vaccine, and there are different kinds of vaccines under test right now. Do you think that is possible? Everyone can have a vaccine?
I don't think so, because I think it's Merck and it's a Johnson & Johnson company.
We don't want to mention the companies too many times. We don't want to do any advertisement for any company at this point. But my question really is, will vaccine be available to everyone?
First, I think it's short of supply for the vaccine. Second, the local people, they don't accept vaccination. So I think the distrust is a problem there. So
I see. Professor Shi, last time in 2014, when the outbreak last time was happening, Chinese medical teams were being sent over there.
Yes.
How were the issue being resolved then? And as a result, can we learn from the last experience?
Yes. I think our team came to the Sierra Leone and they make sure everybody can be tested for the Ebola virus, and they control the people in some regions and avoid them to contacting with others. So I think the separate the infected people from the uninfected people is very important. So this is the experience from the team.
How much does it take to do that, to separate the infected from those who are not? In a local place like Sierra Leone then in 2014, and now people have to think about it in the Democratic Republic of Congo.
So I think it depends, because you should test the people and ask the people to accept the tests. So if the people can ready to be tested, so I think maybe it will take half a year. Yeah.
Given that is the timeline, Dr. Ding, we are talking about, half a year, this outbreak would already become quite something, right? And now it's already the second largest in history. So is there something that can be done with emergency to prevent it from spreading around even further? Closing the border is not the way, because people argue, who's going to help us if we close the border? Dr. Ding.
Right. Right. We definitely do not want to close the border, but you have to be very vigilant, and this is why WHO declared emergency, because they're calling for assistance from countries around the world. They need immediately $26 million in the next 3 months to contain it, or else it will be way more widespread. And WHO has been bearing the brunt so far for the last few months trying to contain it. And Ebola is something that sometimes, even if you're affected, doesn't show symptoms for 9 or 10 days. And so the containment resources for anyone infected, community infected, is enormous. There's more than just vaccines. There's more vaccines on the horizon, but we need to improve the cold chains for vaccines, getting access to the vaccines, and affording all the containment and the mobilization. And yes, there's local issues, the cultural issues, but we have to mobilize, and all the countries of the world have to pitch in with this emergency and provide support immediately.
Now, here's the thing always, Dr. Ding, that who will play a pivotal role? Is it going to be international organizations like the WHO, or is it going to be international medical teams like we've witnessed some of them in 2014 in Sierra Leone, or is it local people, and particularly local medical circles and communities, going to play a much bigger role given the context of the Democratic Republic of Congo?
Right. Well, right now, Doctors Without Borders, many other NGOs, and WHO have been there for months and months already. But clearly, it's not enough. To prevent a global pandemic in which this is spreading across the globe, we need to have all the resources. Militaries have to be involved. And last time, the U.S. military actually provided a lot of the vaccine and all the containment infrastructure. Other countries need to get involved now. And other organizations like Last Mile Health that helped contain the Ebola in Liberia, we need more organizations, not just in Congo, but mobilize the world. And that is what the WHO Emergency Declaration does. We need $26 million in 3 months, as well as all the countries in the world to send resources now before it becomes everyone's problem.
And before it becomes everyone's problem, what should everybody else be doing? Professor Shi, here's the question for you. What about the other African countries? What should they do now to prevent the disease further spreading to their territories? Professor.
So actually, if we want to prevent this Ebola from one country to another country, you must make sure the people who is suspected to be infected by Ebola virus, they should be tested correctly, and we should in time make sure the people don't run from one place to another place, and make sure the infected people will not contact the other people. And also, I think the vaccine is also very important. Yeah.
Well, I guess we've been talking about some of the principles, gentlemen, but one of the most important things is to really how to implement these principles on the ground. For now, I want to thank you anyway for your input and your insights. Eric Ding and Shi Yi, really appreciate it. Thank you. And that is all the time we have for today. If you'd like to see more, try to find us World Insight CGTN into your search engine, or check out our YouTube channel. Follow us on Twitter, Facebook, and see the Weibo from Tian Wei and everyone on the World Insight team. Thanks for watching. Tune in again next time for more insights across China and around the world. Bye for now. Thank you.